A lower face and neck lift adds the neck procedure to the mini facelift of the upper face. So the rejuvenation includes the neck and the jowl, this area here, and everything from here down is rejuvenated. There's very little rejuvenation from this level of the face upwards with the lower face and neck lift. But in many individuals, this is a workhorse facelift procedure because many individuals don't have as much aging around the eyes or the brow, and so in general, their face is rejuvenated by changing the tissues from here down and making this area look more youthful. It is a very similar recovery as a mini facelift, except that there's some tightness in the neck. It doesn't appear tight, it just feels tight for several weeks. It's not a painful tightness, it's just an awareness that most patients should be aware of prior to surgery. It helps a lot when you know what to expect. These procedures are done under a local anesthesia with IV sedation or a light general anesthesia. They're done as a day surgery procedure. 95% of patients go home immediately after the surgery. The next day they're shampooed and showered. The sutures or the stitches hidden along the edge of the ear and in the crease of the ear and sometimes along the hairline are removed within 4 to 5 days. And most patients are back to their normal work activities in an office setting within 5 to 6 days. A lower face and neck lift, to be natural, must have the direct pull of the skin. The pull of the skin is the most important part of the facelift. And in this case, in any facelift, the direction of the pull needs to be vertical because a more vertical pull allows the face to age naturally after it's been elevated. It doesn't look distorted because elevation in this direction is distorting, as many of you may have seen in different individuals in your community or celebrities. So the most important part of any of these facelifts is the direction of the pull. So make sure your surgeon talks to you about that.